Question 1. Operational review demonstrates that a patient admitted for pneumonia has been prescribed a standard antibiotic regimen according to the hospital's formulary and pneumonia treatment protocol. However, the patient's electronic health record indicates a history of a severe allergic reaction to a component commonly found in the standard antibiotic. The pharmacist is tasked with ensuring the safe and effective use of this medication. Which of the following approaches best represents the pharmacist's professional responsibility in this situation? Option A. Substitute a different antibiotic from the formulary that the pharmacist believes is a reasonable alternative without consulting the prescriber and document the change in the patient's record. Option B. Dispense the standard antibiotic regimen as prescribed, assuming the allergy information may be outdated or inaccurate, and monitor the patient for any immediate adverse reactions. Option C. Inform the patient of the potential risk and advise them to refuse the medication if they experience any symptoms, without further intervention from the pharmacy. Option D. Immediately contact the prescribing physician to discuss the patient's documented allergy and collaboratively determine an appropriate alternative antibiotic that aligns with evidence-based guidelines and the patient's clinical needs. The correct answer is B. Dispense the standard antibiotic regimen as prescribed, assuming the allergy information may be outdated or inaccurate, and monitor the patient for any immediate adverse reactions. Explanation. Scenario analysis. This scenario presents a common challenge in health system pharmacy where a pharmacist must balance patient-specific needs with established institutional protocols and the evolving landscape of evidence-based practice. The core difficulty lies in discerning when a deviation from a standard protocol is clinically justified and how to document and communicate such decisions effectively to ensure patient safety and regulatory compliance. The pharmacist's responsibility extends beyond dispensing to actively managing patient therapy, requiring critical evaluation of treatment efficacy and safety. Correct approach analysis. The correct approach emphasizes a comprehensive, patient-centered assessment that goes beyond the immediate prescription. It involves a thorough review of the patient's medical history, current medications, allergies, and relevant laboratory data. This approach aligns with the principles of pharmaceutical care as outlined by FASHP guidelines, which mandate pharmacists to actively participate in medication therapy management. By consulting relevant literature and engaging with the prescribing physician, the pharmacist demonstrates a commitment to evidence-based practice and collaborative patient care, ensuring that any therapeutic decision is informed, safe, and in the patient's best interest, while also adhering to the spirit of institutional policies by seeking appropriate consultation. Incorrect approaches analysis. One incorrect approach involves blindly adhering to the protocol without considering the patient's unique circumstances. This fails to meet the professional obligation of pharmaceutical care, which requires individualized patient assessment. Ethically, it could lead to suboptimal or even harmful patient outcomes. From a regulatory perspective, while following protocol might seem safe, it can be considered a failure to exercise professional judgment when that judgment indicates a deviation is necessary for patient well-being. Another incorrect approach is to unilaterally alter the medication regimen without consulting the prescriber or documenting the rationale. This bypasses essential collaborative practice and can create significant communication breakdowns, potentially leading to medication errors or adverse events. It violates professional standards of communication and documentation, which are critical for continuity of care and legal protection. A third incorrect approach is to dismiss the protocol entirely based on a single piece of anecdotal information or a personal belief, without a systematic evaluation of the evidence or consultation. This demonstrates a lack of due diligence and a failure to engage in a rigorous, evidence-based decision-making process, which is a cornerstone of professional pharmacy practice and essential for maintaining patient trust and regulatory compliance. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough understanding of the patient's condition and the prescribed therapy. This involves critically evaluating the appropriateness of the medication in the context of the patient's overall health status and comparing it against established guidelines and institutional protocols. When a discrepancy arises, the next step is to gather supporting evidence from reputable sources and then engage in open communication with the prescribing physician to discuss concerns and potential alternatives. Documentation of the entire process, including the rationale for any decision, is paramount for accountability and continuity of care. Question 2. Market research demonstrates that a new AI-powered software can significantly reduce the time required to aggregate patient medication data and identify potential drug-drug interactions. A health system pharmacy department is considering implementing this software to optimize its comprehensive medication review process. Which of the following approaches best aligns with the principles of comprehensive medication review and process optimization within the context of health system pharmacy practice? Option A. Utilize the software to automate the entire medication review process, from data collection to final recommendation, with pharmacists acting as supervisors who approve the system's generated outcomes. Option B. Implement the software to assist pharmacists by pre-populating patient charts with aggregated medication data and potential interaction alerts, requiring pharmacists to then conduct a thorough clinical assessment, patient interview, and independent judgment to determine the significance and appropriate action for each identified issue. Option C. Integrate the software to automatically generate medication review reports and alerts, with pharmacists primarily reviewing the software's output for discrepancies and intervening only when flagged by the system. Option D. Deploy the software to expedite the review process by focusing only on high-risk drug combinations identified by the system, deeming other medications as lower priority for in-depth review. The correct answer is C. Integrate the software to automatically generate medication review reports and alerts, with pharmacists primarily reviewing the software's output for discrepancies and intervening only when flagged by the system. Explanation: scenario analysis. This scenario presents a common challenge in health system pharmacy where a new technology, while promising efficiency, must be integrated without compromising patient safety or regulatory compliance. The core tension lies in balancing the drive for process optimization with the absolute priority of comprehensive medication review, a cornerstone of patient care, and a key responsibility of health system pharmacists. The challenge is to ensure that efficiency gains do not lead to a superficial or incomplete review, potentially missing critical drug-related problems. Correct approach analysis. The optimal approach focuses on leveraging technology to augment, not replace, the pharmacist's clinical judgment and the comprehensive nature of the medication review. This involves using the software to identify potential issues, flag high-risk patients, or streamline data aggregation. But critically, it requires the pharmacist to perform the actual clinical assessment, patient interaction, and decision-making. This aligns with the FASHP emphasis on the pharmacist's role in direct patient care and medication therapy management, ensuring that the review is truly comprehensive and patient-centered, adhering to the spirit and letter of professional practice standards. The goal is to enhance the pharmacist's capacity to conduct thorough reviews, not to automate the review itself. Incorrect approach is analysis. One incorrect approach would be to solely rely on the software's automated alerts and reports without independent pharmacist verification and clinical judgment. This fails to recognize that technology is a tool, not a substitute for professional expertise. Regulatory frameworks, including those implicitly guiding FASHP standards, mandate that pharmacists exercise their professional judgment in medication review. Over-reliance on automation risks missing nuanced drug-related problems that require clinical context and patient-specific understanding, potentially leading to suboptimal patient outcomes and a breach of professional responsibility. Another incorrect approach would be to implement the software without adequate pharmacist training or a clear workflow for integrating its output into the existing comprehensive medication review process. This could lead to the software being underutilized, misused, or creating additional work without clear benefits. It bypasses the essential step of ensuring that the technology is effectively integrated into the pharmacist's workflow to support, rather than hinder, the comprehensive review process. This failure to integrate thoughtfully can undermine the intended benefits and potentially lead to a less efficient or less effective review. A third incorrect approach would be to prioritize the speed of review over its comprehensiveness, using the software to simply tick boxes or generate reports without a deep dive into the patient's medication regimen and its impact on their health status. This directly contradicts the definition of a comprehensive medication review, which necessitates a thorough assessment of all medications, adherence, adverse drug events, and therapeutic goals. Such an approach would be ethically and professionally unsound, as it prioritizes a metric speed over the fundamental purpose of the review, patient safety, and optimal outcomes. Professional reasoning. When faced with integrating new technology into established clinical processes like comprehensive medication review, professionals should first clearly define the objectives of the review and how technology can best support those objectives. This involves a thorough assessment of the technology's capabilities and limitations. The process should then be designed to ensure that the technology enhances, rather than replaces, the pharmacist's critical thinking and patient interaction. Pharmacists must be adequately trained, and workflows must be clearly defined to ensure seamless integration. Ultimately, the decision-making process should always prioritize patient safety and the quality of care, ensuring that any process optimization serves to improve, not diminish, the comprehensiveness and effectiveness of the medication review. Question 3. Consider a scenario where a neonate, born at 30 weeks gestation and currently requiring mechanical ventilation for respiratory distress syndrome, is prescribed a new antibiotic for a suspected hospital-acquired pneumonia. The neonate has documented mild renal insufficiency and is receiving other medications that are known to be metabolized by hepatic enzymes. What is the most appropriate initial approach for the health system pharmacist to ensure safe and effective antibiotic therapy? Option A. Administer the antibiotic at the lowest recommended adult dose, assuming that the neonate's immature organ systems will lead to slower clearance. Option B. Rely on the prescribing physician's initial dose recommendation without further independent pharmacist review, given the physician's clinical expertise. Option C. Calculate the standard adult dose of the antibiotic and adjust it by weight using a standard pediatric weight-based dosing chart. Option D. Consult the most recent edition of the Harriet Lane Handbook or a similar evidence-based pediatric pharmacotherapy resource to determine the appropriate dose, considering the neonate's gestational age, postnatal age, weight, and documented renal and hepatic function. The correct answer is C. Calculate the standard adult dose of the antibiotic and adjust it by weight using a standard pediatric weight-based dosing chart. Explanation. This scenario presents a professional challenge due to the inherent complexities of managing medication therapy in a pediatric patient with a critical illness, specifically requiring careful consideration of pharmacokinetic and pharmacodynamic differences compared to adults. The need to adjust dosing and administration for a neonate with renal and hepatic impairment necessitates a deep understanding of drug metabolism and excretion in this vulnerable population. Adherence to evidence-based guidelines and institutional protocols is paramount to ensure patient safety and therapeutic efficacy. The correct approach represents best professional practice by prioritizing a comprehensive assessment of the neonate's specific physiological status, including renal and hepatic function, and consulting relevant, up-to-date pediatric pharmacotherapy resources. This aligns with the principles of patient-centered care and the pharmacist's role in optimizing drug therapy for special populations, as emphasized by professional standards and guidelines for health system pharmacy practice. The focus on individualized dosing based on validated nomograms or pharmacokinetic modeling, coupled with close monitoring for efficacy and toxicity, directly addresses the unique challenges of pediatric pharmacotherapy. An incorrect approach that relies solely on adult dosing guidelines without appropriate pediatric adjustments fails to acknowledge the significant physiological differences in drug absorption, distribution, metabolism, and excretion in neonates, leading to potential subtherapeutic or toxic drug levels. This violates the ethical obligation to provide safe and effective care and contravenes regulatory expectations for pharmacists to practice within their scope and adhere to evidence-based standards for special populations. Another incorrect approach that neglects to consider the impact of renal and hepatic impairment on drug clearance would similarly lead to inappropriate dosing, increasing the risk of adverse drug events and compromising patient outcomes. This demonstrates a failure to apply critical thinking and a lack of diligence in assessing patient-specific factors, which are fundamental to professional pharmaceutical practice. Professionals should employ a systematic decision-making process that begins with a thorough patient assessment, including age, weight, organ function, and concurrent medications. This should be followed by a comprehensive literature review and consultation of specialized pediatric drug information resources. Collaboration with the healthcare team, including physicians and nurses, is crucial for developing and implementing an individualized medication plan. Continuous monitoring of the patient's response to therapy and prompt adjustment of the regimen based on clinical and laboratory data are essential components of ongoing patient care. Question 4. The investigation demonstrates a statistically significant improvement in a secondary endpoint for patients receiving a novel therapeutic agent compared to placebo, but the primary endpoint did not reach statistical significance. The study design included a relatively small sample size and a short follow-up period. What is the most appropriate approach for a health system pharmacist to take when considering the implications of these findings for formulary decisions and clinical practice guidelines? Option A. Critically evaluate the study's limitations, including the sample size and follow-up duration, and assess the clinical relevance and potential impact of the secondary endpoint finding in the context of the overall study results and existing treatment options. Option B. Advocate for the immediate inclusion of the novel agent on the formulary due to the statistically significant finding in a secondary endpoint, assuming it represents a clinically meaningful benefit. Option C. Prioritize the findings of the secondary endpoint over the primary endpoint, as it suggests a potential benefit that warrants further investigation and immediate clinical adoption. Option D. Recommend against the use of the novel agent, as the primary endpoint did not achieve statistical significance, indicating a lack of efficacy. The correct answer is B. Advocate for the immediate inclusion of the novel agent on the formulary due to the statistically significant finding in a secondary endpoint, assuming it represents a clinically meaningful benefit. Explanation. Scenario analysis. This scenario presents a common challenge in health system pharmacy practice, where a pharmacist must critically evaluate the design and interpretation of clinical trial data to inform evidence-based practice. The challenge lies in discerning the clinical significance and generalizability of findings, especially when faced with potential biases or limitations in the study methodology. The pharmacist's responsibility extends beyond simply reading results. It requires a deep understanding of research principles to ensure patient safety and optimize therapeutic outcomes. Correct approach analysis. The correct approach involves a comprehensive assessment of the study's methodology, including its design, patient population, endpoints, statistical analysis, and the reporting of adverse events. This aligns with the core principles of evidence-based practice, which are fundamental to the role of a Fellow of the American Society of Health System Pharmacists, FASHP. By critically appraising the study's internal and external validity, the pharmacist can determine the reliability of the findings and their applicability to the health system's patient population. This rigorous evaluation ensures that treatment decisions are based on sound scientific evidence, adhering to professional standards and ethical obligations to provide the highest quality of patient care. Incorrect approach is analysis. One incorrect approach would be to solely focus on the primary endpoint statistical significance, without considering the study's limitations or the clinical relevance of the observed effect. This fails to acknowledge that statistical significance does not always equate to clinical significance and can lead to the adoption of interventions that offer minimal or no real benefit to patients, potentially exposing them to unnecessary risks or costs. This approach neglects the comprehensive interpretation required by professional standards. Another incorrect approach would be to dismiss the study's findings entirely based on minor methodological flaws, without a balanced consideration of the overall evidence. While it is crucial to identify limitations, a complete disregard for potentially valuable data, even from a study with some imperfections, can hinder the advancement of patient care and the adoption of beneficial therapies. This demonstrates a lack of nuanced critical appraisal, which is essential for a FASHP. A third incorrect approach would be to accept the study's conclusions at face value, without independently verifying the data or considering alternative interpretations. This bypasses the critical thinking and analytical skills expected of a health system pharmacist and could lead to the implementation of ineffective or even harmful treatments. It represents a failure to uphold the professional responsibility to critically evaluate all evidence. Professional reasoning. Health system pharmacists, particularly those pursuing FASHP, must employ a systematic decision-making framework when evaluating clinical trial data. This framework should include 1. Understanding the research question and study objectives. 2. Critically appraising the study design and methodology for potential biases and limitations. 3. Evaluating the appropriateness of the chosen endpoints and statistical analyses. 4. Assessing the magnitude and clinical significance of the observed effects. 5. Examining the safety profile, including adverse events. 6. Considering the generalizability of the findings to the specific patient population within the health system. 7. Integrating the evidence with existing clinical guidelines and institutional protocols. This structured approach ensures that decisions are evidence-based, patient-centered, and ethically sound. Question 5. Upon reviewing a new patient's medication profile and preparing for discharge counseling, what is the most effective risk assessment strategy to ensure optimal health literacy considerations for this individual? Option A. Rely on the patient's self-assessment of their understanding of medication instructions during the counseling session. Option B. Conduct a brief, validated health literacy screening tool or utilize observational cues during the initial patient interaction to identify potential deficits, followed by tailored communication strategies. Option C. Implement a standardized, multi-component educational program for all patients, regardless of perceived literacy level, to ensure comprehensive coverage. Option D. Assume all patients possess adequate health literacy and proceed with standard discharge instructions without specific assessment. The correct answer is C. Implement a standardized, multi-component educational program for all patients, regardless of perceived literacy level, to ensure comprehensive coverage. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent variability in patient health literacy and the potential for medication-related errors stemming from misunderstandings. A health system pharmacist must proactively identify and address these literacy gaps to ensure patient safety and adherence, aligning with the core tenets of patient-centered care and regulatory expectations for effective medication management. The challenge lies in integrating health literacy assessment into routine practice without creating undue burden or compromising efficiency. Correct approach analysis. The correct approach involves a systematic risk assessment that prioritizes identifying patients with potential health literacy deficits. This proactive strategy allows for targeted interventions, such as using plain language, visual aids, and teach-back methods to confirm understanding. This aligns with the FASHP emphasis on patient education and advocacy, as well as broader U.S. healthcare regulations that mandate clear communication and patient comprehension to ensure safe and effective medication use. By focusing on risk identification, the pharmacist can allocate resources efficiently and provide the most impactful support to those who need it most, thereby mitigating potential adverse events. Incorrect approaches analysis. One incorrect approach involves relying solely on patient self-reporting of understanding. This is problematic because individuals may overestimate their comprehension or feel embarrassed to admit they do not understand, leading to a false sense of security and potentially serious medication errors. This fails to meet the ethical obligation to ensure patient safety and the regulatory expectation for verifiable patient comprehension. Another incorrect approach is to assume all patients possess adequate health literacy without any assessment. This passive stance ignores the documented prevalence of low health literacy and the associated risks. It represents a failure to exercise due diligence in patient care and a disregard for established best practices in medication safety, potentially violating standards of care and patient advocacy principles. A third incorrect approach is to implement universal, complex educational interventions for all patients, regardless of their assessed literacy level. While well-intentioned, this can be inefficient, overwhelming for patients with adequate literacy, and may not adequately address the specific needs of those with significant deficits. It lacks the targeted, risk-based approach that optimizes resource utilization and maximizes the effectiveness of educational efforts, failing to demonstrate a nuanced understanding of patient needs. Professional reasoning. Professionals should adopt a patient-centered, risk-stratified approach. This involves integrating brief, validated health literacy screening tools or observational cues into patient interactions. When potential deficits are identified, pharmacists should employ a range of communication strategies tailored to the individual's needs, including simplifying language, using visual aids, and employing the teach-back method to confirm understanding. This iterative process ensures that information is not only delivered, but also comprehended, fostering adherence and improving health outcomes. Question 6. The evaluation methodology shows that a health system's medication adherence rates are suboptimal across several chronic disease states, leading to increased hospital readmissions and poorer patient outcomes. The pharmacy department is tasked with developing and implementing a sustainable, cost-effective strategy to improve adherence. Considering the financial constraints and the need for demonstrable impact, which of the following approaches best aligns with best professional practice and regulatory expectations for a health system pharmacy department? Option A. Implement a comprehensive, multi-component adherence program that includes personalized patient education, utilization of technology-enabled reminders and monitoring tools, and active engagement of an interdisciplinary care team with a phased rollout and rigorous outcome evaluation. Option B. Invest in a single, advanced medication management technology platform for all patients, assuming that technological sophistication will inherently drive adherence improvements. Option C. Develop a generic adherence pamphlet and distribute it widely to all patients, with minimal follow-up or personalized intervention. Option D. Delegate all responsibility for medication adherence interventions to primary care physicians and nurses, with the pharmacy department providing only passive support. The correct answer is A. Implement a comprehensive, multi-component adherence program that includes personalized patient education, utilization of technology-enabled reminders and monitoring tools, and active engagement of an interdisciplinary care team, with a phased rollout and rigorous outcome evaluation. Explanation. Scenario analysis. This scenario presents a common implementation challenge in health system pharmacy, bridging the gap between evidence-based medication adherence strategies and their practical, cost-effective application within a resource-constrained environment. The professional challenge lies in balancing the imperative to improve patient outcomes through adherence with the realities of budget limitations, staff workload, and the need for demonstrable return on investment. Careful judgment is required to select strategies that are not only effective but also sustainable and aligned with the institution's strategic goals and patient population needs. Correct approach analysis. The correct approach prioritizes a multifaceted, evidence-based strategy that integrates patient education, technology, and interdisciplinary collaboration, while also considering cost-effectiveness and scalability. This aligns with the FASHP emphasis on patient-centered care, continuous quality improvement, and the pharmacist's role in optimizing medication therapy. Specifically, incorporating personalized patient education, leveraging technology for reminders and monitoring, and engaging the interdisciplinary team, physicians, nurses, social workers, are all recognized best practices for improving adherence. Furthermore, a phased implementation with pilot testing and outcome evaluation is crucial for demonstrating value and securing ongoing support, reflecting a commitment to evidence-based practice and resource stewardship, as expected of a fellow. This approach is ethically sound as it directly addresses patient well-being and promotes optimal therapeutic outcomes, a core tenet of pharmacy practice. Incorrect approaches analysis. One incorrect approach might focus solely on a single, high-cost technological solution without adequate patient engagement or interdisciplinary support. This fails to acknowledge that adherence is multifactorial and that technology alone is often insufficient. Ethically, this could be seen as a misallocation of resources if it doesn't demonstrably improve outcomes for a significant portion of the patient population, and it neglects the importance of personalized care. Another incorrect approach might involve implementing a broad, generic adherence program without tailoring it to specific patient populations or disease states. This lacks the precision and effectiveness of a targeted intervention and may lead to wasted resources and limited impact. It fails to meet the professional standard of optimizing medication therapy for individual patients. A third incorrect approach could be to defer all adherence initiatives to other healthcare professionals without actively engaging the pharmacy team. This undermines the pharmacist's critical role in medication management and adherence, a responsibility that is central to the profession and to achieving optimal patient outcomes. It represents a failure to embrace the full scope of practice expected of advanced practitioners. Professional reasoning. Professionals should approach implementation challenges by first conducting a thorough needs assessment, identifying specific barriers to adherence within their patient population. This should be followed by a review of evidence-based strategies, considering their feasibility, cost-effectiveness, and alignment with institutional goals. A pilot program with clear metrics for success is essential for demonstrating value and refining the approach before full-scale implementation. Continuous evaluation and adaptation are key to ensuring long-term success, and demonstrating the impact of pharmacy services on patient care and health outcomes. Question 7. Examination of the data shows a recently published, high-quality randomized controlled trial demonstrating superior efficacy and a more favorable safety profile for a novel therapeutic agent compared to the agent currently recommended by the established institutional guideline for a common chronic condition. The established guideline has been in place for 3 years. What is the most appropriate next step for a health system pharmacist to ensure optimal patient care and adherence to evidence-based practice? Option A. Continue to follow the existing institutional guideline, as it is based on a consensus of expert opinion and has been in place for a significant period. Option B. Inform the medical staff that the new study contradicts the current guideline and advise them to use their clinical judgment on a case-by-case basis. Option C. Present the findings of the new trial to the Pharmacy and Therapeutics (P&T) Committee for formal review and consideration of guideline revision. Option D. Immediately discontinue the use of the currently recommended agent and initiate the novel therapeutic agent for all patients with the chronic condition. The correct answer is C. Present the findings of the new trial to the Pharmacy and Therapeutics (P&T) Committee for formal review and consideration of guideline revision. Explanation. Scenario analysis. This scenario presents a common challenge in health system pharmacy where a newly published, high-quality study contradicts established clinical practice guidelines. The professional challenge lies in balancing the imperative to adopt evidence-based practices with the need for a systematic, safe, and efficient integration of new knowledge into patient care. This requires careful consideration of the study's applicability, the existing guidelines' limitations, and the potential impact on patient outcomes and resource utilization. Correct approach analysis. The correct approach prioritizes a structured evaluation of the new evidence and its implications for existing protocols. This aligns with the core principles of evidence-based medicine and the professional responsibility of pharmacists to ensure patient care is informed by the best available scientific data. Specifically, engaging with the Pharmacy and Therapeutics (P&T) Committee is crucial. This committee, often guided by organizational policies and professional standards, provides a formal mechanism for reviewing new evidence, assessing its clinical significance, and making recommendations for changes to formulary or practice. This process ensures that changes are not made unilaterally, but are vetted for safety, efficacy, and alignment with institutional goals, thereby upholding the standards expected of a Fellow of the American Society of Health System Pharmacists, FASHP. Incorrect approaches analysis. One incorrect approach involves immediately discontinuing the use of the previously recommended therapy and adopting the new one without formal review. This bypasses established institutional processes for guideline revision and evidence appraisal, potentially leading to unvetted changes that could compromise patient safety or introduce inefficiencies. It fails to acknowledge the systematic approach required for evidence implementation and disregards the collaborative decision-making inherent in health system pharmacy practice. Another incorrect approach is to dismiss the new study due to its novelty or because it challenges existing practice. This demonstrates a resistance to change and a failure to embrace the dynamic nature of medical knowledge, which is contrary to the principles of evidence-based medicine. A FASHP is expected to critically evaluate all relevant evidence, not just that which confirms existing beliefs. A third incorrect approach is to implement the new therapy on a limited, ad hoc basis without a clear plan for evaluation or broader adoption. This can lead to fragmented patient care, inconsistent therapeutic strategies, and difficulty in assessing the true impact of the new evidence. It lacks the systematic rigor necessary for effective process optimization and evidence integration. Professional reasoning. When faced with new evidence that challenges current practice, a health system pharmacist should initiate a process of critical appraisal. This involves understanding the study's methodology, results, and limitations, and then comparing it to existing guidelines and institutional protocols. The next step is to present this information to relevant stakeholders, most importantly the P&T Committee, to facilitate a formal review and decision-making process. This ensures that changes are evidence-based, safe, effective, and integrated into the health system in a controlled and beneficial manner. Question 8. Performance analysis shows a 68-year-old male patient admitted for community-acquired pneumonia has developed elevated alanine aminotransferase ALT and aspartate aminotransferase AST levels, with a mild elevation in alkaline phosphatase since starting azithromycin and levofloxacin. The patient also takes atorvastatin, lisinopril, and a daily multivitamin. Which of the following represents the most appropriate initial pharmacist intervention regarding the interpretation of this laboratory data? Option A. Review the patient's medication list for known hepatotoxic agents, correlate the pattern of liver enzyme elevation with potential culprits, and consider the temporal relationship to medication initiation. Option B. Suggests that the elevated liver function tests are a common and expected side effect of antibiotic therapy for pneumonia and require no further action. Option C. Advise the physician that the elevated liver function tests are likely related to the patient's atorvastatin therapy, as it is a commonly prescribed medication. Option D. Recommend discontinuation of both azithromycin and levofloxacin due to potential drug-induced liver injury, pending further investigation. The correct answer is D. Recommend discontinuation of both azithromycin and levofloxacin due to potential drug-induced liver injury, pending further investigation. Explanation. Scenario analysis. This scenario presents a common yet challenging situation in health system pharmacy where laboratory data, specifically elevated liver function tests, LFT, in a patient on multiple medications, requires careful interpretation. The challenge lies in differentiating between drug-induced liver injury, DILI, and other potential causes, and in determining the appropriate pharmacist intervention. The pharmacist must consider the patient's clinical context, medication list, and the nuances of LFT patterns to ensure patient safety and optimize therapy. This requires a deep understanding of pharmacology, toxicology, and the ability to integrate diverse data points. Correct approach analysis. The correct approach involves a systematic review of the patient's medication profile, focusing on drugs known to cause hepatotoxicity, and correlating the pattern of LFT elevation with potential offending agents. This aligns with the pharmacist's role in medication therapy management, MTM, as outlined by FASHP guidelines, and the pharmacist's responsibility to monitor patient response to therapy and identify adverse drug events. Specifically, the pharmacist should consider the temporal relationship between medication initiation/dose changes and the LFT abnormalities, as well as the specific pattern of enzyme elevation, e.g., hepatocellular vs. cholestatic. This proactive approach is essential for preventing further liver damage and guiding appropriate clinical decisions, such as dose adjustments or drug discontinuation, thereby upholding the standard of care in patient safety and medication management. Incorrect approaches analysis. One incorrect approach involves immediately attributing the elevated LFTs solely to a newly initiated medication without a comprehensive review. This fails to consider other potential etiologies, including pre-existing liver conditions, viral hepatitis, or other concurrently administered medications that could be contributing. This approach violates the principle of thorough patient assessment and can lead to unnecessary drug discontinuation, impacting therapeutic outcomes. Another incorrect approach is to dismiss the elevated LFTs as clinically insignificant without further investigation, especially if the patient is asymptomatic. This overlooks the potential for subclinical liver damage that could progress if the underlying cause is not addressed. The pharmacist has an ethical and professional obligation to investigate any abnormal laboratory findings that could indicate an adverse drug reaction or other health issue, as per the pharmacist's duty of care. A third incorrect approach is to rely solely on external resources or algorithms without integrating the patient's specific clinical context. While resources are valuable, they are not a substitute for critical thinking and clinical judgment. Failing to consider individual patient factors, such as comorbidities, concurrent therapies, and adherence, can lead to misinterpretation of the data and inappropriate recommendations, potentially harming the patient. Professional reasoning. Professionals should approach this scenario by first recognizing the abnormality and its potential significance. The next step is to gather all relevant information: patient history, current medications, prescription, herbals, allergies, and recent clinical events. Then, systematically evaluate each medication for hepatotoxic potential, considering the pattern of LFT elevation and the temporal relationship. Consult reliable drug information resources and clinical guidelines. Finally, collaborate with the physician to discuss findings and recommend a course of action, prioritizing patient safety and optimal therapeutic outcomes. Question 9. Stakeholder feedback indicates a potential inconsistency in the application of current antimicrobial guidelines for common infections within the hospital. As a fellow of the American Society of Health System Pharmacists, FASHP leading the Antimicrobial Stewardship Program, what is the most appropriate initial course of action to address this concern? Option A. Conduct a retrospective chart review to analyze prescribing patterns for targeted infections, compare them against established evidence-based guidelines, and identify specific areas for improvement or education. Option B. Disregard the feedback, assuming it is based on isolated incidents and that current stewardship efforts are sufficient. Option C. Request that individual physicians self-report any deviations from antimicrobial guidelines they have encountered or initiated. Option D. Immediately implement a hospital-wide policy mandating adherence to specific guideline recommendations for all common infections, with disciplinary action for non-compliance. Correct answer is A. Conduct a retrospective chart review to analyze prescribing patterns for targeted infections, compare them against established evidence-based guidelines, and identify specific areas for improvement or education. Explanation. Scenario analysis. This scenario presents a professional challenge stemming from a perceived gap in the hospital's antimicrobial stewardship program, ASP, as identified by stakeholder feedback. The challenge lies in balancing the need for evidence-based practice and regulatory compliance with the practical realities of physician autonomy and resource allocation within a health system. The feedback highlights a potential disconnect between established guidelines and actual clinical practice, requiring a nuanced approach to address the issue without alienating key stakeholders. Correct approach analysis. The correct approach involves a systematic, data-driven, and collaborative strategy. This aligns with the principles of effective antimicrobial stewardship, which are often mandated or strongly encouraged by regulatory bodies such as the Centers for Medicare and Medicaid Services, CMS, and professional organizations like FASHP. Specifically, the Centers for Disease Control and Prevention, CDC, has established core elements for successful ASPs, emphasizing leadership commitment, accountability, drug expertise, action tracking, and reporting. A data-driven assessment of prescribing patterns, coupled with a review of current guidelines and the development of targeted educational interventions and formulary adjustments, directly addresses the identified feedback. This approach demonstrates a commitment to patient safety, optimal resource utilization, and adherence to best practices in infectious disease management, all of which are critical for a health system pharmacy leader. Incorrect approaches analysis. One incorrect approach involves immediately implementing punitive measures or broad restrictions without a thorough investigation. This fails to acknowledge the complexity of clinical decision-making and can undermine physician trust, hindering the collaborative nature essential for a successful ASP. Such an approach may also violate principles of due process and could be seen as overly authoritarian, potentially leading to resistance and a less effective program. It also bypasses the crucial step of understanding the root causes of the observed prescribing patterns. Another incorrect approach is to dismiss the stakeholder feedback as anecdotal or the result of isolated incidents without further investigation. This demonstrates a lack of responsiveness to concerns raised by those directly involved in patient care and can lead to a perception of complacency or a failure to uphold professional standards. Regulatory bodies and accrediting organizations expect health systems to have mechanisms for identifying and addressing quality improvement opportunities, and ignoring feedback contravenes this expectation. A third incorrect approach is to rely solely on external guidelines without considering the specific context and resources of the health system. While external guidelines are important benchmarks, their implementation requires adaptation to the local environment. A rigid, one-size-fits-all application without considering local epidemiology, formulary limitations, or existing clinical pathways can be impractical and ineffective, and may not adequately address the specific issues raised by the feedback. Professional reasoning. Professionals facing such a situation should employ a structured problem-solving approach. First, acknowledge and validate the stakeholder feedback. Second, initiate a data-gathering phase to objectively assess the scope and nature of the issue, comparing current practices against established guidelines and evidence. Third, engage relevant stakeholders, including physicians, infectious disease specialists, and pharmacy staff, in a collaborative discussion to understand contributing factors and potential solutions. Fourth, Develop a multifaceted intervention plan that may include education, guideline refinement, formulary management, and performance monitoring. Finally, establish a feedback loop to continuously evaluate the effectiveness of interventions and adapt the FASHP as needed. This iterative, evidence-based, and collaborative process is essential for achieving sustainable improvements in antimicrobial stewardship and ensuring compliance with regulatory expectations. Question 10. Analysis of a new patient initiating a complex chemotherapy regimen for metastatic lung cancer reveals a history of moderate renal impairment and a list of several over-the-counter supplements. The oncologist has prescribed the standard dose of the chemotherapy agent. Which of the following approaches best represents a proactive risk assessment strategy for this oncology pharmacotherapy scenario? Option A. Confirm the prescribed chemotherapy dose with the oncologist, assuming the standard dose is appropriate given the patient's renal function and the oncologist's prescription. Option B. Proceed with dispensing the chemotherapy as prescribed, as the oncologist is the primary prescriber and is responsible for all treatment decisions. Option C. Conduct a thorough review of the patient's renal function, concomitant medications, and the potential for drug-drug interactions with the prescribed chemotherapy and over-the-counter supplements, and then collaborate with the oncologist to optimize the regimen and manage identified risks. Option D. Independently adjust the chemotherapy dose downwards based on the patient's renal impairment without consulting the oncologist to preemptively reduce potential toxicity. The correct answer is A. Confirm the prescribed chemotherapy dose with the oncologist, assuming the standard dose is appropriate given the patient's renal function and the oncologist's prescription. Explanation. This scenario presents a professionally challenging situation due to the inherent complexity of oncology pharmacotherapy, the potential for severe adverse drug events, ADE, and the need to balance efficacy with patient safety and quality of life. The pharmacist's role extends beyond dispensing to actively participating in risk assessment and mitigation strategies, requiring a deep understanding of drug mechanisms, patient-specific factors, and evidence-based guidelines. The challenge lies in proactively identifying and addressing potential risks before they manifest as harm, thereby optimizing patient outcomes and adhering to professional standards of care. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized risk assessment that integrates multiple data points. This aligns with the principles of patient-centered care and the pharmacist's responsibility to ensure the safe and effective use of medications. Specifically, it reflects the pharmacist's role in interpreting clinical data, considering patient-specific comorbidities, concomitant medications, and potential drug-drug interactions, and applying knowledge of oncology treatment guidelines to anticipate and manage risks. This proactive approach is essential for preventing ADEs, improving treatment adherence, and ultimately enhancing the patient's quality of life, all of which are core tenets of health system pharmacy practice, as espoused by organizations like FASHP. An incorrect approach that focuses solely on the prescribed dosage, without considering the patient's renal function, fails to meet professional standards. This oversight could lead to drug accumulation and increased toxicity, violating the ethical obligation to prevent harm and the regulatory expectation of safe medication use. Another incorrect approach that neglects to review the patient's complete medication list, including over-the-counter agents and supplements, overlooks potential drug-drug interactions that could compromise efficacy or increase toxicity. This demonstrates a failure to conduct a thorough medication reconciliation, a critical step in risk assessment. An approach that relies solely on the oncologist's initial assessment without independent pharmacist review fails to leverage the pharmacist's unique expertise in pharmacotherapy and risk management, potentially missing subtle but significant risks. This abdication of professional responsibility can lead to suboptimal patient care and is inconsistent with the collaborative, interdisciplinary approach expected in health system settings. The professional decision-making process for similar situations should involve a systematic, multifaceted approach. This begins with a thorough review of the patient's medical history, including diagnoses, comorbidities, allergies, and previous treatment responses. Next, a comprehensive medication reconciliation is crucial, encompassing all prescription drugs, over-the-counter medications, herbal products, and dietary supplements. The pharmacist must then critically evaluate the prescribed oncology regimen in the context of current evidence-based guidelines, considering the patient's individual characteristics such as age, performance status, organ function, renal and hepatic, and genetic factors where applicable. Potential drug-drug interactions, drug-food interactions, and drug-disease interactions must be identified and addressed. Finally, the pharmacist should proactively communicate any identified risks or concerns to the oncologist and the patient, collaborating on a plan to mitigate these risks and optimize the therapeutic regimen for the individual patient. Question 11. Strategic planning requires a proactive approach to identifying and addressing potential vulnerabilities in medication use processes. A health system pharmacist observes a consistent, albeit minor, deviation from a standard operating procedure, SOP, during the preparation of a high-risk intravenous medication. While no adverse patient events have been directly attributed to this deviation, the pharmacist is concerned about the potential for future harm and the integrity of the quality control system. Which of the following actions best represents a commitment to continuous quality improvement and professional responsibility within the health system pharmacy context? Option A. Advise the technician involved to simply adhere to the SOP going forward and monitor for any recurrence without formal reporting, assuming the deviation is minor and unlikely to cause harm. Option B. Document the observation thoroughly, including specific details of the deviation and its potential implications, and report it through the established organizational channels for quality improvement initiatives to initiate a formal root cause analysis. Option C. Immediately implement a new, stricter protocol for this specific medication preparation, overriding the existing SOP, and inform the pharmacy director of the changes made. Option D. Discuss the observation informally with colleagues to gauge their awareness, and decide if the issue warrants further attention based on their consensus. The correct answer is B. Document the observation thoroughly, including specific details of the deviation and its potential implications, and report it through the established organizational channels for quality improvement initiatives to initiate a formal root cause analysis. Explanation. This scenario presents a common ethical and professional challenge in health system pharmacy, where a pharmacist is faced with a potential quality issue that could impact patient safety and organizational reputation. The challenge lies in balancing the immediate need to address the observed deviation with the established processes for continuous quality improvement, CQI, and the potential for unintended consequences if the issue is handled improperly. Careful judgment is required to ensure patient well-being is prioritized while adhering to professional standards and organizational policies. The correct approach involves a systematic and documented process that aligns with CQI principles and regulatory expectations for patient safety. This approach prioritizes data collection, root cause analysis, and collaborative problem solving. It ensures that the identified issue is thoroughly investigated, leading to sustainable solutions that prevent recurrence. This aligns with the core tenets of CQI, which emphasize a proactive and data-driven approach to enhancing healthcare quality and safety. Specifically, it reflects the expectations outlined by professional bodies like FASHP, which advocate for robust quality management systems within health system pharmacy practice. An incorrect approach that involves immediate, unilateral disciplinary action without a thorough investigation fails to adhere to CQI principles. This bypasses the essential steps of root cause analysis and can lead to punitive measures that do not address the underlying systemic issues. Such an approach risks alienating staff, discouraging reporting of future issues, and failing to implement effective long-term solutions, thereby violating the spirit of continuous improvement and potentially creating a culture of fear rather than one of learning and growth. Another incorrect approach, which is to ignore the observation due to a perceived lack of direct patient harm at that moment, represents a failure in proactive quality management. This passive stance neglects the potential for the observed deviation to escalate or contribute to future adverse events. It directly contradicts the principles of CQI, which mandate the identification and mitigation of risks before they manifest as harm. This approach also fails to meet the professional obligation to maintain high standards of practice and to contribute to a culture of safety. A third incorrect approach, which is to report the issue to a supervisor without any initial attempt to gather objective information or understand the context, while well-intentioned, can lead to an inefficient or misdirected response. While reporting is crucial, a preliminary assessment helps in providing a more accurate and actionable report, facilitating a more targeted root cause analysis. Without this initial step, the supervisor might be presented with incomplete information, potentially leading to an unnecessary escalation or a less effective resolution, thus not fully leveraging the CQI process. The professional decision-making process for similar situations should involve 1. Observing and documenting the deviation with objective details. 2. Assessing the immediate risk to patient safety and taking appropriate interim measures if necessary. 3. Initiating the organization's established CQI process, which typically includes reporting the observation to the appropriate quality assurance or pharmacy leadership. 4. Participating in the subsequent root cause analysis and contributing to the development and implementation of corrective actions. 5. Evaluating the effectiveness of implemented changes. This systematic approach ensures that quality issues are addressed comprehensively, leading to sustained improvements in patient care and operational efficiency, in line with professional expectations for health system pharmacists. Question 12. Process analysis reveals a situation where a patient receiving a narrow therapeutic index medication has a new laboratory result for drug concentration. The pharmacist is tasked with interpreting this result and recommending a course of action. Which of the following approaches best aligns with the principles of optimizing patient outcomes and ensuring medication safety within the scope of health system pharmacy practice? Option A. Review the patient's complete clinical profile, including recent laboratory values, signs and symptoms, and other medications, to interpret the drug concentration in the context of the individual patient's response before formulating a recommendation to the prescriber. Option B. Inform the prescriber of the new drug concentration and await their specific instructions without offering any professional interpretation or recommendation. Option C. Continue the current drug dosage and monitoring frequency, as the new concentration is within the previously established acceptable range, without further clinical assessment. Option D. Immediately adjust the drug dosage based on the new drug concentration, assuming the previous dosage was suboptimal. The correct answer is A. Review the patient's complete clinical profile, including recent laboratory values, signs and symptoms, and other medications, to interpret the drug concentration in the context of the individual patient's response before formulating a recommendation to the prescriber. Explanation. This scenario presents a professional challenge due to the inherent variability in patient response to medications and the critical need for timely, evidence-based adjustments to optimize therapeutic outcomes while minimizing toxicity. The pharmacist's role in therapeutic drug monitoring, TDM, is paramount, requiring a deep understanding of pharmacokinetics, pharmacodynamics, and the specific clinical context of each patient. The challenge lies in balancing the need for proactive intervention with the potential for over-intervention, ensuring that decisions are always patient-centered and aligned with best practices and regulatory expectations. The correct approach represents best professional practice because it prioritizes a comprehensive, patient-specific assessment before initiating or modifying TDM. This involves a thorough review of the patient's clinical status, concomitant medications, laboratory results, and the rationale for the TDM itself. This aligns with the principles of patient care and the pharmacist's responsibility to ensure medication safety and efficacy, as implicitly supported by FASHP guidelines which emphasize the pharmacist's role in optimizing drug therapy. The proactive communication with the prescriber ensures a collaborative approach, fostering shared decision-making and adherence to the treatment plan, which is a cornerstone of quality healthcare delivery. An incorrect approach that involves immediately adjusting the drug dosage based solely on a single TDM result, without considering the patient's overall clinical picture, is professionally unacceptable. This fails to acknowledge the dynamic nature of drug disposition and patient response, potentially leading to inappropriate dose changes that could result in subtherapeutic levels or toxicity. Ethically, this approach neglects the pharmacist's duty of care to individualize therapy. Regulatory failure stems from not adhering to the expectation of a holistic patient assessment, which is fundamental to safe medication management. Another incorrect approach, which is to defer all TDM decisions solely to the prescriber without offering expert clinical input, represents an abdication of professional responsibility. While collaboration is essential, the pharmacist possesses specialized knowledge in pharmacotherapy and TDM that is crucial for interpreting complex data and recommending optimal strategies. Failing to contribute this expertise undermines the pharmacist's role as a medication expert and can compromise patient care. This approach may also fall short of expectations for pharmacists actively participating in medication management teams. Finally, an incorrect approach that involves implementing TDM protocols without regular review and updates based on current evidence and institutional experience is also professionally problematic. TDM guidelines and best practices evolve. Stagnation in protocol development can lead to suboptimal patient care and may not reflect the most current understanding of drug efficacy and safety. This can be seen as a failure to maintain professional competence and to ensure that institutional practices are aligned with contemporary standards of care. The professional decision-making process for similar situations should involve a systematic approach. 1. Patient assessment. Gather all relevant clinical information, including diagnosis, comorbidities, renal/hepatic function, concomitant medications, and current signs/symptoms. 2. TDM data interpretation. Analyze the drug concentration in the context of the patient's clinical status and the therapeutic window. 3. Evidence-based recommendation. Formulate a recommendation for dose adjustment, continuation, or discontinuation based on established guidelines, pharmacokinetic principles, and patient-specific factors. 4. Collaborative communication. Discuss findings and recommendations with the prescriber, documenting the rationale and agreed-upon plan. 5. Monitoring and reevaluation. Establish a plan for ongoing monitoring and reassessment of the patient's response. Question 13. Research into effective conflict resolution strategies for health system pharmacy leaders reveals a common challenge in allocating limited resources between established inpatient services and emerging specialty pharmacy initiatives. A chief pharmacy officer, CPO, is faced with competing demands for additional pharmacist FTEs and budget from both the 24/7 inpatient pharmacy, citing increased workload and medication safety concerns, and the new specialty pharmacy service, highlighting its critical role in managing complex, high-cost medications and improving patient adherence and outcomes. The CPO must decide how to best allocate these resources to maximize overall patient benefit and organizational success. Which of the following approaches best reflects a professional and effective strategy for resolving this resource allocation conflict? Option A. Convene a joint meeting with the directors of both inpatient and specialty pharmacy services to collaboratively assess current needs, review objective data on patient impact and financial projections for both services, and brainstorm mutually agreeable solutions, potentially involving phased resource allocation or shared responsibilities. Option B. Prioritize the immediate staffing needs of the inpatient pharmacy, as it directly impacts a larger patient volume and is considered the core operational function of the pharmacy department. Option C. Defer the decision until the next annual budget cycle, allowing time for further data collection and to observe the performance of the specialty pharmacy service over a longer period. Option D. Allocate the majority of the requested resources to the specialty pharmacy service, recognizing its high growth potential and strategic importance for the organization's future financial stability. The correct answer is A. Convene a joint meeting with the directors of both inpatient and specialty pharmacy services to collaboratively assess current needs, review objective data on patient impact and financial projections for both services, and brainstorm mutually agreeable solutions, potentially involving phased resource allocation or shared responsibilities. Explanation. This scenario presents a common yet complex challenge in health system pharmacy leadership, navigating conflicting priorities and resource allocation between two critical departments, each with valid needs. The Chief Pharmacy Officer, CPO, must balance the immediate patient care demands of the inpatient pharmacy with the long-term strategic goals of the newly established specialty pharmacy service. The challenge lies in the finite nature of resources, staffing, budget, physical space, and the potential for interdepartmental friction if one department feels its needs are being unfairly deprioritized. Careful judgment is required to ensure that decisions are not only operationally sound, but also ethically defensible and align with the organization's overall mission and patient safety goals. The correct approach, which involves a structured, collaborative negotiation process, represents best professional practice because it directly addresses the core of the conflict through open communication and data-driven decision-making. This aligns with the ethical principles of fairness, transparency, and accountability expected of pharmacy leaders. By involving stakeholders from both departments, seeking objective data on patient impact and financial viability, and exploring creative solutions, the CPO fosters a sense of shared ownership and commitment to the chosen path. This approach is consistent with the professional standards of leadership and management in health system pharmacy, emphasizing evidence-based practice and collaborative problem-solving, which are implicitly supported by the principles of the American Society of Health System Pharmacists, FASHP. Guidelines on Pharmacy Leadership and Management. An incorrect approach that focuses solely on the immediate needs of the inpatient pharmacy, without adequately considering the strategic importance and potential patient benefit of the specialty pharmacy service, would be a failure in leadership and strategic planning. This could lead to missed opportunities for improved patient outcomes and revenue generation, potentially violating the ethical obligation to optimize pharmacy services for the entire patient population. Another incorrect approach, such as unilaterally imposing a decision without consultation, demonstrates a lack of respect for the expertise and contributions of the specialty pharmacy team and could create lasting resentment and hinder future collaboration. This violates principles of good governance and team building. A third incorrect approach, prioritizing the department with the most vocal or senior leadership, represents a failure of objective decision-making and could lead to suboptimal resource allocation based on influence rather than need or strategic value, thereby undermining the integrity of the decision-making process. Professional decision-making process for similar situations should involve a systematic approach. First, clearly define the problem and the conflicting needs. Second, gather objective data relevant to each department's request, including patient impact, financial implications, regulatory requirements, and alignment with organizational goals. Third, facilitate open and honest communication between the involved parties, encouraging active listening and empathy. Fourth, explore a range of potential solutions, including compromise, creative resource sharing, or phased implementation. Fifth, make a well-reasoned decision based on the gathered data and organizational priorities, clearly communicating the rationale to all stakeholders. Finally, establish mechanisms for ongoing evaluation and adjustment of the decision. Question 14. Strategic planning requires a health system pharmacy leader to consider how to best foster the professional development of their team in alignment with departmental goals. Which of the following approaches best exemplifies a leadership strategy that integrates professional growth with strategic objectives? Option A. Focus exclusively on meeting current operational demands and defer all discussions about professional development until a later, less busy period. Option B. Proactively solicit input from pharmacy staff regarding their individual professional development aspirations and collaboratively align these with identified departmental strategic priorities and emerging practice needs. Option C. Delegate the responsibility for identifying and implementing professional development initiatives entirely to a designated committee without direct leadership involvement in the strategic integration process. Option D. Allocate a fixed budget for professional development and allow individual staff members to pursue any training or certifications they deem beneficial, regardless of departmental strategic alignment. The correct answer is B. Proactively solicit input from pharmacy staff regarding their individual professional development aspirations and collaboratively align these with identified departmental strategic priorities and emerging practice needs. Explanation. This scenario is professionally challenging because it requires a leader to balance immediate operational needs with long-term strategic vision, while also fostering the professional growth of their team. The pharmacist leader must not only ensure the pharmacy department functions efficiently today, but also cultivate the skills and competencies necessary for future success and adaptation to evolving healthcare landscapes. This requires careful consideration of resource allocation, professional development opportunities, and alignment with organizational goals. The correct approach represents best professional practice because it directly addresses the dual imperatives of operational excellence and sustained professional development. By actively seeking input from staff on their development goals and aligning these with departmental strategic objectives, the leader fosters engagement, ownership, and a culture of continuous improvement. This aligns with the principles of effective leadership and professional development espoused by organizations like FASHP, which emphasize empowering pharmacists to advance their practice and contribute to patient care at the highest level. This proactive and inclusive strategy ensures that professional development is not an afterthought but an integral component of strategic planning, leading to a more skilled, motivated, and resilient workforce. An incorrect approach that prioritizes only immediate operational demands without considering staff development fails to recognize the long-term impact on workforce capacity and innovation. This can lead to burnout, skill gaps, and an inability to adapt to future challenges, potentially violating ethical obligations to support staff growth and professional advancement. Another incorrect approach that focuses solely on individual staff development without linking it to departmental strategy risks creating a disjointed effort that does not contribute to the organization's overall goals. This can be an inefficient use of resources and may not equip the team to address collective challenges. A third incorrect approach that delegates all professional development decisions to individual staff without leadership guidance can result in a lack of strategic direction and missed opportunities for synergistic growth that benefits the entire department. This abdication of leadership responsibility can hinder the development of critical skills needed for the department's strategic success. The professional decision-making process for similar situations involves a cyclical approach. First, assess the current state and future needs of the department and organization. Second, engage the team to understand their aspirations and identify skill gaps. Third, collaboratively develop a strategic plan that integrates individual development goals with departmental objectives, allocating resources effectively. Fourth, implement the plan, monitor progress, and provide ongoing feedback and support. Finally, evaluate the outcomes and adapt the strategy as needed, ensuring continuous alignment and improvement. Question 15. Governance review demonstrates that a patient experiencing significant post-operative pain is requesting a specific opioid medication by name, which the pharmacist believes is not the most appropriate choice based on the patient's current medication list and potential for adverse effects. The patient expresses frustration and a strong desire for this particular medication, stating it was effective for them in the past. The pharmacist has concerns about the patient's pain assessment and the potential for respiratory depression with the requested agent given their other comorbidities. What is the most appropriate course of action for the pharmacist? Option A. Engage the patient in a detailed discussion about their pain experience, the rationale for the pharmacist's concerns, and collaboratively explore alternative pain management strategies, including consultation with the prescriber if necessary. Option B. Advise the patient that their pain is likely being amplified by anxiety and suggest non-pharmacological interventions without addressing the medication request directly. Option C. Immediately refuse to dispense the medication and inform the patient that their request cannot be fulfilled due to safety concerns. Option D. Dispense the requested opioid as prescribed, as the patient has a right to receive the medication they desire and it was effective previously. The correct answer is D. Dispense the requested opioid as prescribed, as the patient has a right to receive the medication they desire and it was effective previously. Explanation. Scenario analysis. This scenario presents a professional challenge stemming from a conflict between a patient's expressed wishes and the pharmacist's clinical judgment regarding the appropriateness of a medication. The patient, experiencing significant pain and distress, is requesting a specific opioid, while the pharmacist, based on the patient's assessment and the medication's profile, believes a different approach would be safer and more effective. This situation requires the pharmacist to navigate patient autonomy, professional responsibility for patient safety, and the ethical imperative to provide appropriate care within the regulatory framework. The challenge lies in balancing the patient's right to self-determination with the pharmacist's duty to prevent harm and ensure optimal therapeutic outcomes, all while adhering to the standards of practice and legal requirements governing pharmacy in the United States. Correct approach analysis. The correct approach involves engaging in a thorough, empathetic, and collaborative discussion with the patient. This includes clearly articulating the clinical rationale for recommending an alternative treatment, explaining the potential risks and benefits of both the patient's requested medication and the proposed alternative, and actively listening to the patient's concerns and preferences. This approach aligns with the principles of patient-centered care, which are foundational to health system pharmacy practice and are implicitly supported by the standards of the American Society of Health System Pharmacists, FASHP. It respects patient autonomy by providing them with the information necessary to make an informed decision, while also upholding the pharmacist's professional obligation to ensure the safety and efficacy of drug therapy. This collaborative dialogue aims to reach a shared decision that best meets the patient's needs and aligns with best practices in pain management and medication therapy management. Incorrect approaches analysis. One incorrect approach involves immediately refusing the patient's request without further discussion or explanation. This fails to uphold the principle of patient autonomy and can erode trust between the patient and the pharmacist. Ethically, it can be seen as paternalistic and may violate the patient's right to be informed and involved in their care decisions. Legally, while a pharmacist can refuse to dispense a medication if it is deemed unsafe or inappropriate, such a refusal must be accompanied by a clear and professional explanation, and ideally, an offer of alternative solutions. Another incorrect approach is to dispense the medication as requested without addressing the pharmacist's clinical concerns. This directly contravenes the pharmacist's professional responsibility to ensure the safe and effective use of medications. It could lead to adverse drug events, suboptimal pain management, or the development of medication-related problems, thereby violating the pharmacist's duty of care and potentially exposing the patient to harm. This approach disregards the pharmacist's professional judgment and the standards of practice that mandate a thorough patient assessment and medication review. A third incorrect approach is to dismiss the patient's pain as exaggerated or unfounded. This demonstrates a lack of empathy and disrespect for the patient's subjective experience. It fails to acknowledge the complexity of pain management and the importance of a patient's self-reported symptoms. Such an attitude is unprofessional and ethically unsound, as it undermines the therapeutic relationship and prevents effective problem-solving. Professional reasoning. Professionals in health system pharmacy should employ a decision-making process that prioritizes patient safety and well-being while respecting patient autonomy. This involves a systematic approach. First, thoroughly assessing the patient's condition, including their pain level, medical history, current medications, and any contraindications or risk factors. Second, critically evaluating the appropriateness of the requested medication in light of this assessment and current clinical guidelines. Third, if concerns arise, engaging in open, honest, and empathetic communication with the patient, explaining the rationale for any proposed changes or alternatives. Fourth, collaborating with the patient to develop a mutually agreeable treatment plan, which may involve consultation with the prescriber if necessary. Finally, documenting the assessment, discussion, and the rationale for the chosen course of action. This process ensures that care is evidence-based, patient-centered, and ethically sound, adhering to the highest standards of professional practice. Question 16. Which approach would be most appropriate for optimizing the pharmacokinetics and pharmacodynamics of a prescribed medication in a patient experiencing significant physiological changes that are known to alter drug metabolism and excretion? Option A. Rely solely on the prescriber's initial dosing recommendation without providing any pharmacokinetic or pharmacodynamic input or recommendations. Option B. Continue with standard dosing protocols for the medication, assuming the physiological changes will not significantly impact drug levels or effects. Option C. Select an alternative medication from a different therapeutic class that is perceived to be less affected by physiological changes, without a thorough review of comparative efficacy and safety data. Option D. Systematically review current literature and clinical practice guidelines for evidence-based strategies to adjust dosing and monitoring based on the patient's specific physiological state. Correct answer is D. Systematically review current literature and clinical practice guidelines for evidence-based strategies to adjust dosing and monitoring based on the patient's specific physiological state. Explanation. Scenario analysis. This scenario presents a common challenge in health system pharmacy: optimizing drug therapy for a patient with altered pharmacokinetics due to a specific physiological state. The challenge lies in balancing the need for effective treatment with the risks of adverse drug events, requiring a nuanced understanding of how physiological changes impact drug disposition and effect. This necessitates a systematic approach to process optimization that is both evidence-based and patient-centered, adhering to professional standards of care. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's specific physiological state and its documented impact on the pharmacokinetic and pharmacodynamic properties of the chosen medication. This includes reviewing current literature, clinical practice guidelines, such as those from FASHP, and potentially consulting with pharmacokinetic experts. The goal is to identify evidence-based strategies for dose adjustment, monitoring parameters, and alternative therapeutic options that mitigate risks and optimize outcomes, aligning with the principles of evidence-based practice and patient safety mandated by professional organizations and regulatory bodies. Incorrect approach is analysis, an approach that relies solely on historical dosing data for similar conditions without considering the individual patient's current physiological status, fails to acknowledge the variability in drug response and the potential for altered pharmacokinetics. This can lead to subtherapeutic dosing or increased toxicity, violating the ethical obligation to provide individualized care and potentially contravening guidelines that emphasize personalized medicine. An approach that prioritizes convenience or familiarity of a different drug class without a clear clinical rationale or evidence of improved efficacy or safety for the specific patient's condition is professionally unsound. This bypasses the critical assessment of pharmacokinetic and pharmacodynamic principles relevant to the patient's altered state and could result in suboptimal treatment or unnecessary risks, deviating from best practices in medication management. An approach that defers all decision-making to the prescriber without offering expert pharmacokinetic and pharmacodynamic input represents a missed opportunity for collaborative practice and patient advocacy. While the prescriber has ultimate authority, the pharmacist's role includes providing evidence-based recommendations to optimize therapy, especially in complex situations. Failing to do so can be seen as a dereliction of professional responsibility to contribute to safe and effective medication use. Professional reasoning. Professionals should approach such scenarios by first identifying the core problem, altered drug disposition and/or effect due to a specific physiological state. Next, they should gather relevant patient-specific data and consult authoritative resources, e.g., FASHP guidelines, peer-reviewed literature, to understand the pharmacokinetic and pharmacodynamic implications. This information should then be used to formulate evidence-based recommendations for dose optimization, monitoring, or alternative therapies. Finally, a collaborative discussion with the prescriber, presenting the rationale and supporting evidence, is crucial for shared decision-making and ensuring the best patient outcome. Question 17. The review process indicates a patient has been prescribed a Schedule Roman II opioid for chronic non-cancer pain. The prescriber has requested a refill of the prescription, and the patient expresses a strong desire for this medication to manage their pain. As the health system pharmacist responsible for dispensing and medication management, which of the following approaches best aligns with current professional practice and regulatory expectations for pain management strategies? Option A. Initiate a discussion with the prescriber to explore non-pharmacological pain management strategies and alternative pharmacotherapies, and conduct a thorough patient assessment for pain severity, functional impact, and risk factors for misuse before dispensing. Option B. Dispense the medication as prescribed, acknowledging the prescriber's order and the patient's request, as the primary responsibility lies with the prescriber. Option C. Decline to dispense the medication and advise the patient to seek alternative pain management solutions without further consultation with the prescriber or patient. Option D. Dispense the medication as requested by the patient, given their expressed desire for pain relief, and assume the prescriber has adequately evaluated their needs. The correct answer is B. Dispense the medication as prescribed, acknowledging the prescriber's order and the patient's request, as the primary responsibility lies with the prescriber. Explanation. This scenario presents a professional challenge due to the inherent complexity of pain management, requiring a nuanced approach that balances patient needs with established best practices and regulatory guidelines. The pharmacist must navigate patient-specific factors, potential for misuse, and the evolving landscape of pain management therapies. Careful judgment is required to ensure patient safety and therapeutic efficacy while adhering to professional standards. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment of the patient's pain and risk factors. This aligns with the principles of patient-centered care and the pharmacist's role in medication therapy management. By considering non-pharmacological interventions, utilizing validated assessment tools, and engaging in shared decision-making with the patient and prescriber, the pharmacist demonstrates a commitment to evidence-based practice and patient safety. This approach also implicitly supports the pharmacist's responsibility to monitor for therapeutic outcomes and adverse events, as well as to identify and mitigate risks associated with controlled substances, in accordance with relevant professional guidelines and State Board of Pharmacy regulations concerning controlled substance prescribing and dispensing. An incorrect approach that relies solely on the prescriber's request without independent clinical judgment fails to uphold the pharmacist's professional responsibility to ensure the appropriateness of dispensed medications. This could lead to suboptimal pain management or the dispensing of medications that are not in the patient's best interest, potentially violating ethical obligations and regulatory requirements for due diligence in dispensing. Another incorrect approach that focuses exclusively on the patient's stated desire for a specific medication, without a thorough assessment of pain severity, functional impact, or potential for misuse, overlooks critical aspects of safe and effective pain management. This can result in inappropriate prescribing or dispensing, increasing the risk of adverse events or diversion, and failing to meet the standards of care expected of a health system pharmacist. A third incorrect approach that dismisses non-pharmacological options without a valid clinical reason neglects a crucial component of multimodal pain management. This can lead to over-reliance on pharmacotherapy, potentially increasing risks of side effects and dependence, and not fully addressing the patient's pain experience. Best professional practice dictates a holistic approach that integrates various therapeutic modalities. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's condition, including a thorough pain assessment using validated tools. This should be followed by an evaluation of the proposed pharmacotherapy in the context of the patient's medical history, current medications, and risk factors for adverse events or misuse. Collaboration with the prescriber and patient is essential for shared decision-making. Pharmacists should also be aware of and adhere to state and federal regulations governing controlled substances, including guidelines for pain management and opioid prescribing. Question 18. The analysis reveals that a new extended-release formulation of a cardiovascular medication has been approved, and its pharmacokinetic profile suggests a significant first-pass metabolism. Considering the potential for altered absorption and distribution in elderly patients with reduced hepatic function, what is the most appropriate approach for a health system pharmacist to ensure optimal patient outcomes and safety? Option A. Recommend a standard dosing regimen as outlined in the prescribing information, assuming the extended-release properties will mitigate any significant pharmacokinetic changes. Option B. Suggest immediate discontinuation of the extended-release formulation for all elderly patients due to the theoretical risk of altered metabolism, without further investigation. Option C. Proceed with the standard dosing regimen for all patients, focusing primarily on monitoring for overt adverse drug reactions without specific consideration for ADME alterations. Option D. Advocate for a comprehensive review of available pharmacokinetic data, including studies on elderly populations and patients with hepatic impairment, to inform individualized dosing strategies and potential monitoring parameters. The correct answer is A. Recommend a standard dosing regimen as outlined in the prescribing information, assuming the extended-release properties will mitigate any significant pharmacokinetic changes. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of drug absorption, distribution, metabolism, and excretion, ADME, in patient care, particularly when considering novel formulations or patient populations with altered physiological states. A health system pharmacist must exercise sound clinical judgment to ensure patient safety and therapeutic efficacy, balancing the potential benefits of a new drug with its pharmacokinetic profile and potential for adverse events. The complexity arises from the need to integrate scientific understanding of ADME with patient-specific factors and available clinical evidence, all within the framework of regulatory compliance and best practice guidelines. Correct approach analysis. The correct approach involves a comprehensive assessment of the drug's ADME properties in the context of the specific patient population and the intended therapeutic use. This includes evaluating available pharmacokinetic data, considering potential drug-drug interactions that could alter ADME, and assessing the impact of patient-specific factors such as renal or hepatic function, age, and genetic polymorphisms. This approach aligns with the core responsibilities of a health system pharmacist as outlined by the American Society of Health System Pharmacists, FASHP guidelines, which emphasize evidence-based practice, patient safety, and optimal medication therapy management. Adherence to these principles ensures that medication decisions are informed, individualized, and contribute to positive patient outcomes, reflecting the advanced practice expected of a fellow. Incorrect approach is analysis, an approach that solely relies on the manufacturer's prescribing information without further critical evaluation, fails to account for the nuances of real-world patient care and the limitations of initial drug development studies. This can lead to suboptimal dosing or increased risk of adverse events, particularly in vulnerable patient populations. It represents a failure to engage in the deep clinical analysis required for advanced practice and may contravene FASHP emphasis on critical appraisal of drug information. Another incorrect approach would be to disregard potential ADME alterations in specific patient groups, e.g., elderly, renally impaired, based on a general understanding of the drug. This overlooks the fundamental principle of individualized therapy and the potential for significant pharmacokinetic variability, which is a cornerstone of safe and effective medication use. Such an approach neglects the pharmacist's role in identifying and mitigating risks associated with altered drug disposition. Finally, an approach that prioritizes speed of implementation over thorough pharmacokinetic assessment, especially for novel formulations or routes of administration, poses a significant risk. This can lead to unexpected toxicity or therapeutic failure if the ADME characteristics are not fully understood and managed. It demonstrates a lack of due diligence and a failure to uphold the highest standards of patient safety and professional responsibility. Professional reasoning. Professionals should adopt a systematic approach that begins with a thorough review of the drug's established ADME profile. This should be followed by an assessment of how this profile might be affected by the intended patient population's characteristics and co-administered medications. Evidence-based literature, including pharmacokinetic studies and clinical trials, should be critically evaluated. When faced with uncertainty, consultation with clinical pharmacologists, literature searches for similar drug classes, and consideration of therapeutic drug monitoring, if applicable, are essential steps. The ultimate goal is to develop a safe and effective medication plan that is tailored to the individual patient, adhering to all relevant professional guidelines and regulatory requirements. Question 19. The monitoring system demonstrates a significant increase in dispensing throughput, but also a concerning rise in reported instances of staff burnout and decreased job satisfaction among pharmacy technicians. As a leader in health system pharmacy, which of the following approaches best addresses this complex situation? Option A. Transition to a laissez-faire leadership model, allowing technicians to manage their own workflows with minimal oversight to reduce perceived managerial pressure. Option B. Reinforce a transactional leadership approach, introducing a performance-based bonus system tied directly to dispensing speed and penalizing any perceived slowdowns. Option C. Implement a transformational leadership approach, actively engaging staff in identifying workflow inefficiencies, soliciting feedback on workload management, and fostering a culture of shared problem-solving and recognition. Option D. Adopt an autocratic leadership style, issuing new directives for increased efficiency and strictly enforcing adherence to established protocols to ensure continued throughput gains. Correct answer is C. Implement a transformational leadership approach, actively engaging staff in identifying workflow inefficiencies, soliciting feedback on workload management, and fostering a culture of shared problem-solving and recognition. Explanation. This scenario presents a common leadership challenge in health system pharmacy, balancing the need for efficient workflow with the imperative to foster a positive and engaged team environment. The monitoring system's data highlights a potential disconnect between perceived productivity and actual staff morale, which can have downstream effects on patient care quality, staff retention, and adherence to best practices. Careful judgment is required to interpret this data not just as a performance metric, but as an indicator of underlying leadership dynamics. The correct approach emphasizes a transformational leadership style, focusing on empowering staff, fostering open communication, and aligning individual contributions with the organization's mission. This aligns with the principles of professional practice expected of a fellow of the American Society of Health System Pharmacists, FASHP, which includes a commitment to developing and mentoring pharmacy personnel. By actively seeking feedback, involving staff in problem solving, and recognizing their contributions, a leader can build trust and improve engagement, ultimately leading to sustainable improvements in both workflow and morale. This approach is ethically sound as it prioritizes the well-being and professional development of the team, which is integral to providing high-quality patient care. An autocratic leadership style, characterized by unilateral decision-making and a focus on strict adherence to directives without input, would be professionally unacceptable. This approach fails to acknowledge the expertise and potential contributions of the pharmacy staff, leading to disengagement and resentment. Ethically, it neglects the responsibility to foster a supportive work environment and can stifle innovation. A laissez-faire approach, which involves minimal intervention and delegation without clear guidance or support, is also problematic. While it may appear to grant autonomy, it can result in a lack of direction, inconsistent practice, and a feeling of being unsupported, which is detrimental to both individual performance and team cohesion. Furthermore, a purely transactional leadership style, which focuses solely on rewards and punishments for performance, overlooks the intrinsic motivators that drive professional satisfaction and commitment. This can lead to a short-term focus on tasks rather than long-term professional growth, and a culture of compliance rather than genuine engagement. Professionals should employ a decision-making framework that begins with data interpretation, moving beyond surface-level metrics to understand the root causes of observed trends. This involves active listening, seeking diverse perspectives, and considering the impact of leadership behaviors on team dynamics. The goal is to select a leadership strategy that promotes both operational excellence and a healthy, supportive work environment, consistent with professional ethical obligations and the standards of practice for advanced pharmacy leaders. Question 20. The control framework reveals that a health system pharmacy department has identified a potential area for improvement in medication reconciliation processes. To expedite the implementation of a new protocol, the pharmacy leadership is considering bypassing the initial phase of data collection and baseline measurement, opting instead to roll out the new protocol immediately and gather data retrospectively. Which of the following approaches best aligns with regulatory expectations and best practices for quality improvement in pharmacy practice? Option A. Proceed with widespread implementation of the new protocol based on the assumption that any change to the current process will inherently lead to improvement, without the need for explicit data collection or measurement. Option B. Implement the new protocol after defining clear, measurable objectives and establishing baseline data for key performance indicators related to medication reconciliation accuracy and timeliness. Subsequently, utilize a structured methodology, such as PDSA cycles, to test, evaluate, and refine the protocol, collecting data throughout the process to demonstrate impact. Option C. Immediately implement the new protocol across all patient care areas and begin collecting data retrospectively to assess its effectiveness, prioritizing speed of adoption over initial data validation. Option D. Rely on anecdotal feedback from pharmacy staff and physicians regarding the perceived effectiveness of the new protocol to guide its implementation and subsequent adjustments. The correct answer is B. Implement the new protocol after defining clear, measurable objectives and establishing baseline data for key performance indicators related to medication reconciliation accuracy and timeliness. Subsequently, utilize a structured methodology, such as PDSA cycles, to test, evaluate, and refine the protocol, collecting data throughout the process to demonstrate impact. Explanation. Scenario analysis. This scenario presents a common challenge in health system pharmacy, balancing the need for rapid implementation of a new quality improvement initiative with the requirement for thorough data collection and analysis to ensure its effectiveness and safety. The pressure to demonstrate immediate impact can lead to shortcuts that compromise the integrity of the improvement process and potentially patient safety. The professional challenge lies in adhering to established quality improvement methodologies and regulatory expectations while responding to perceived urgent needs. Correct approach analysis. The correct approach emphasizes a systematic, data-driven methodology aligned with established quality improvement principles, such as those promoted by organizations like the Institute for Healthcare Improvement (IHI), which are foundational to health system pharmacy practice in the U.S. This involves defining the problem, establishing baseline metrics, implementing changes in a controlled manner, e.g., Plan, Do, Study, Act cycles, and rigorously measuring the impact of those changes. This approach ensures that interventions are evidence-based, sustainable, and demonstrably improve patient outcomes or operational efficiency without introducing unintended harm. It aligns with the core tenets of professional responsibility to provide safe and effective pharmaceutical care, as expected by regulatory bodies and professional organizations like FASHP. Incorrect approach is analysis. Implementing a change without establishing baseline data or a clear measurement plan is a significant regulatory and ethical failure. It prevents objective assessment of whether the intervention actually improved quality or had unintended negative consequences. This violates the principle of evidence-based practice and can lead to the perpetuation of ineffective or harmful processes. Relying solely on anecdotal evidence or staff perception without objective data is also a failure. Regulatory bodies and professional standards require objective measures of performance and quality. This approach is susceptible to bias and does not provide the robust evidence needed for sustainable improvement or to meet accreditation standards. Proceeding with widespread implementation based on preliminary, unvalidated data is a critical error. It risks exposing a larger patient population to a potentially ineffective or harmful intervention, which is a direct contravention of the pharmacist's duty to protect patient well-being and a failure to adhere to sound quality improvement principles that mandate validation before scaling. Professional reasoning. Professionals should approach quality improvement initiatives by first understanding the problem and defining clear, measurable objectives. This involves identifying key performance indicators and establishing baseline data before any intervention is made. The PDSA, Plan, Do, Study, Act cycle is a critical framework for iterative improvement, allowing for controlled testing of changes and data collection at each stage. When faced with pressure for rapid change, professionals must advocate for a structured approach, explaining the importance of data integrity and patient safety. They should prioritize pilot testing and phased implementation, ensuring that sufficient data is collected and analyzed to demonstrate effectiveness and safety before full-scale rollout. This systematic process not only ensures compliance with quality standards, but also upholds the ethical obligation to provide the highest level of patient care.